The Ministry of Health is reporting that another person has died of COVID-19. The person was an elderly male with comorbidities. The latest death brings the death toll to 154. According to the latest update, there are also 24 new positive COVID-19 cases in Trinidad and Tobago. The Health Ministry says the number of cases reported reflects samples taken during the period April 16 to 18 and not the past 24 hours. 296 people are in state quarantine facilities and 84 patients remain at hospital. The total number of active COVID-19 cases now stands at 834. The Ministry of Health has advised of the detection of a variant of concern, or VOC, in a local sample, which was sent to the University of the West Indies for genetic sequences. According to a release from the ministry, the sample sequence revealed the presence of the P1 variant, that's the Brazilian variant. The release further stated the sample was taken from a COVID-19 positive patient in the Nariva Mayaro County and was sent via the Caribbean Public Health Agency, or CARPHA, to the University of the West Indies laboratory. The Ministry of Health says contact tracing required to restrict the spread of the virus has already begun. The public is reminded that all quarantine protocols remain in place to ensure the continued protection of the people of Trinidad and Tobago. Prime Minister Dr. Keith Rowley has tested positive yet again for COVID-19. According to a release from the Office of the Prime Minister on Monday, it stated Prime Minister Rowley was tested today and the result remains the same. The Prime Minister first tested positive for the virus on Tuesday, 6 April 2021. Dr. Rowley will remain in isolation at the official residence in Blenheim and under the care and supervision of the medical professionals from the Tobago Regional Health Authority. There is a 24% increase in COVID-19 hospital occupancy levels in Trinidad and Tobago. This according to Principal Medical Officer Dr. Miriam Abdul-Richards. She was speaking at the Ministry of Health virtual media conference today, Monday. Mahalia Joseph Wharton has more.
Principal Medical Officer Dr. Miriam Abdul-Richards said the increase was noticed at the end of epidemiological week 15 of 2021.
So, for example, at week 11, we had an overall hospital occupancy of 2%. At the end of week 15, we have seen a significant increase in hospital occupancy levels up to 24%. As far as ICU and HDU levels are concerned, ICU levels have increased from approximately 2 to 5% to 25% over a 3-week period.
Previously, HDU levels stood at 0 to 4% between weeks 1 and 11. Dr. Abdul-Richards said there has also been a significant increase in the number of cases in the last 14 days,
which really represents the time span that we would expect to see a surge from a particular event. We, of course, have linked this event to mass congregation and to persons, intermixing, because commingling, of course, is a very bad word in terms of public health. And here we've seen a lot of commingling that is potentially the cause of these increased cases.
She said commingling has been confirmed as a risk factor for transmitting the virus by the WHO.
Another issue is that 80% of persons with COVID-19 tend to have mild or asymptomatic symptoms. So we may have persons who were mixing and commingling amongst the population who did not know that they had COVID-19 and, of course, increasing the risk to persons.
Dr. Abdul-Richards said there was also an increase in the number of cases in the 20 to 49 age group. The Principal Medical Officer said the increase in the rolling average is also worrying. At the end of week 14, the ministry noted an increase from 3 to 32. At the end of week 15, the number has now doubled to 77 cases per day. Mahalia Joseph Wharton, TTT News.